Pantoloc Control is a medicine that contains the active substance pantoprazole. It is available as gastroresistant tablets, 20 mg. Gastroresistant means that the tablets contains pass through the stomach without being broken down until they reach the intestine. This prevents the active substance from being destroyed by the acid in the stomach. Indications. Pantoloc Control is used for the short-term treatment of the symptoms of acid reflux in adults. Acid reflux is when acid produced in the stomach escapes into the gullet, causing heartburn and acid regurgitation, acid following up into the mouth. This medicine can be obtained without a prescription. How to use. Always take this medicine exactly as follows or as the doctor or pharmacist have told. Check with the doctor or pharmacist if not sure. The recommended dose is 1 tablet a day. Do not exceed the recommended dose of 20 mg pantoprazole daily. The patient should take this medicine for at least 2 to 3 consecutive days. Stop taking Pantoloc Control when completely symptom-free. The patient may experience relief from acid reflux and heartburn symptoms after just 1 day of treatment with Pantoloc Control, but this medicine is not meant to bring immediate relief. If the patient has no symptom relief after taking this medicine for 2 weeks continuously, consult the doctor. Do not take Pantoloc Control tablets for more than 4 weeks without consulting the doctor. Take the tablet before a meal at the same time every day. The patient should swallow the tablet whole with some water. Do not chew or break the tablet. If the patient forgets to take Pantoloc Control, do not take a double dose to make up for the forgotten dose. Take the next normal dose the next day at the usual time. For future questions on the use of this medicine, ask the doctor or pharmacist. Contraindications. Do not take Pantoloc Control if the patient is allergic to pantoprazole or to any of the other ingredients of this medicine. Precautions. Before taking pantoprazole, tell a doctor or pharmacist if you are allergic to it or to similar drugs such as lansoprazole or omeprazole, or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to your pharmacist for more details. Before using this medication, tell a doctor or pharmacist your medical history, especially of liver disease, lupus. Side effects. Most people who take pantoprazole do not have any side effects. If you do get a side effect, it is usually mild and will go away when you stop taking pantoprazole. These side effects happen in 1 in 100 people. Talk to a pharmacist or doctor if these side effects bother you or do not go away. Headaches, diarrhea.